Welcome to Access Amplified, the podcast where we shine a light on how digital health is increasing access to care and advancing equity around the world. I'm your host, Joanna Braunold, and our podcast is brought to you by TytoCare. Today's episode is a special edition. As the US government shutdown continues into its fourth week, we're exploring what it means for healthcare access and telehealth across the country. Joining us is Alexis Apple, Director of Federal Affairs at the American Telemedicine Association. Thank you so much for joining us, Alexis.
Yes, thank you so much, Joanna. I'm so happy to be here. Thank you to TytoCare and yourself for having me. I'm excited about the podcast and can't wait to dive into all the nitty gritties about telehealth in the US.
Great. So Alexis is going to bring us a policy insider's view, really on how the shutdown is affecting patients, providers, and also the future of virtual care. And we're also going to talk a little bit about what advocacy efforts are underway, including those that the ATA are working on to protect access for millions of Americans. So let's get started by setting the scene. Alexis, can you start by explaining how the federal shutdown is affecting healthcare operations overall, particularly with a focus on access to care?
Yeah, absolutely. So I'm going to take this back about 5 years ago, right at the beginning of the COVID-19 pandemic, which really was a perfect use case for telehealth overall, right? So since 2020, we've had a series of federal telehealth flexibilities that have been in place that have allowed Medicare patients to receive care virtually from their homes, like you and I are doing right now. And it's allowed providers in the US that deliver care to Medicare beneficiaries to be reimbursed for those visits, which is a key, important thing that I note there. So these flexibilities have been in effect for nearly half a decade now, and it's really helped millions of Americans, millions of Medicare beneficiaries maintain or get new access to care. So now let's think about the government shutdown, right? We've been in a government shutdown for about 24 days now. So we're going into our fourth week. So since October 1st, those Medicare telehealth flexibilities, along with the acute hospital care at home program, have lapsed. This has never happened, right, for the past 5 years. These have been in place for a very long time as of now. So this means the old pre-pandemic restrictions are now back in place for most Medicare services. So unless a patient lives in a designated rural area and they're in a specific clinic or in the four walls of a facility where a provider delivers care, the provider can no longer be reimbursed for those telehealth visits. So therefore, they're no longer going to provide that type of modality, right? Because they're not being reimbursed for
Right.
them. So there's a caveat here, right? So we expect Congress to act on these telehealth flexibilities. We expect them to reinstate them once the government reopens. So therefore, many hospital systems and providers are continuing to deliver telehealth services in hopes that they're going to be reinstated, number one, and number two, retroactively reimbursed for the services during shutdown.
Right.
So I say this because the key here is reimbursement, right? If providers aren't going to be paid for their services, they're not going to offer them. And there's just so much uncertainty right now with how long the government shutdown is going to go on. The longer it goes on, the more it impacts patients, right? So in the beginning, most of our members were like, hey, we're going to continue to provide telehealth services as is because we don't think it's going to last that long, maybe a week or two, we'll see. Well, now we're dragging it on. We could see this going on for 4 weeks to 6 weeks, potentially into the Christmas holiday, which is very concerning. And then our providers, smaller hospital systems, are going to start to pull back even more because they just can't take on that financial risk. There's just so much uncertainty with providers and patients are starting to get concerned too because a lot of these providers are putting out something called an ABN, an advance beneficiary notice. And so what that means basically is they get this form saying, hey, if the federal government doesn't end up paying for this visit, you're held liable.
You're going to be paying for it.
And that's a concern, right? Because if you get a $300 bill in 2 months, right, maybe around the Christmas time or after Christmas, can I afford that visit? I might not show up, number one, or number two, I'm just going to cancel or I'm going to defer to in-person care, which of course we know that can be a big barrier to care. If you live in a rural area and you're 3 hours from your specialist, that's a big barrier. So just lots
If
of
you live in a
confusion.
rural area, the coverage is remaining because as long as you're in a designated rural area.
Right.
How
Designated
much?
rural area, and you have to be in a specific, well,
Okay. Oh, so it's like two factors that requires it to continue. I see. So it's not just like any patient in a rural area.
right. And the patient has to be located in a clinic too.
Okay. So when you're looking at who's affected. So we're talking about, obviously there's populations that rely the most on telehealth, which would be those rural communities, seniors, people with maybe mobility, transportation barriers, families who can't get their kids in. What kind of access gaps are emerging as this continues?
Yeah, I mean, I think you outlined it nicely. So again, I just want to reiterate this only impacts Medicare beneficiaries directly. So it really impacts those, I think, who, like I said, maybe have never received care before. And this was their way to kind of get care to that specialist that maybe was 3 hours away. So whether that's through, they have transportation barriers or mobility barriers, like you just outlined, and they can't get to their doctor, this maybe could actually prohibit them from getting care overall. They may say, I'm just going to opt out. I'm just going to not continue care at this point. So that's a huge concern across the country. I also think, like you outlined, the rural area aspect, not only the distance to the specialist, but also if they had broadband access, like you and I were talking about earlier, right? If they don't have that broadband access, they actually can't even do the video visit. So one of the critical flexibilities that occurred during the pandemic was audio only coverage was allowed. So you could call your doctor, to have a follow up or maybe to get your test results really fast. And sometimes that was better for the elderly patients, right? They didn't have to go into the office. They didn't have to risk getting sick in a facility, or they didn't have to risk opening up their laptop. They could just answer the phone, which we know has been backdated for many years. Everyone's been using the phone for years. So I think that's also a critical component here. But like I said, too, the providers are also really impacted. They're making hard decisions about whether they continue telehealth services. They need to pull them back, suspend them totally. And the more uncertainty there is, the more, it inhibits access to care for patients across the country.
Right. And you mentioned that this is only for Medicare patients, but there are many healthcare systems that are kind of taking their cues from, or health plans that are kind of taking their cues from Medicare patients, and they're going to start to potentially limit those telehealth visits as well. Is that the case? And can you talk about that a little bit?
Yes. So we haven't to date seen commercial payers or Medicaid or Medicare Advantage plans start to pull back on telehealth services yet. But the longer the shutdown goes on, like you said, they do take their cues from Medicare Part B. We could start to see that. And now, it's a really critical time, right? Because we're about to go into open enrollment for all these health plans. And
Yeah.
so what are they going to do? What are we going to see? And are they going to start to pull back on telehealth services over the next few weeks? Maybe, because there's uncertainty at the federal level. Everyone looks to the federal government. It's the largest payer in the country. So of course they're going to take, like you said, their cues from the federal government. And so that's our biggest concern too, is we're going to start to see commercial payers pull back, and we're going to start to see a larger population be impacted, which is a big concern.
And do you have kind of an indication of how many hospitals or health systems have stopped allowing telemedicine?
Yeah. So I can give you that stat from like our membership base. So the ATA, the American Telemedicine Association, has about 450 members. It ranges the gamut of the healthcare industry. So we have hospital systems, we've got providers, we've got virtual only companies, really anyone who's interested in virtual care or is providing virtual care. And about the way I like to frame it is about 1/3 of our members are continuing as is. They're taking on that financial risk, like I said, hoping to get reimbursed in the long term. 1/3 have either suspended telehealth services overall, and another 1/3 are kind of continuing day by day. And then over time, they said the longer the shutdown is, they may start to pull back on telehealth services or stop them overall. So it's really a 1/3 split overall. But like I said, the longer the shutdown goes on, it's going to continue to rise, that suspension number.
And that's a huge amount of services that are stopping. I mean, yeah. And let's talk about what the ATA is doing. So, how are you stepping in to support providers? How are you advocating for continuity of care during this uncertain period?
Yeah, so the ATA and ATA Action, which ATA Action is our advocacy arm, we're really leading the charge during this challenging period. And we're at the forefront. We're making sure our members have the information, the resources, the platforms they need to make informed decisions for their patients and their practices. We're constantly arming our members with the latest intelligence from Capitol Hill, keeping them updated on legislative developments, CMS guidance, and regulatory changes, which are all very important. so they can adapt quickly as the situation evolves. At the same time, we're actively advocating for the reinstatement of the teleflexibilities, like I mentioned, by engaging directly with Congress, the White House, the administration, the different agencies like CMS, HHS, to push for timely action. Um, and a key part of our work, too, is gathering and sharing real world data about patient care use cases, provider use cases, right? What's happening during the shutdown? Really, when we've gotten a lot of questions from Capitol Hill, like, what's actually happening with telehealth? Because they don't really hear that a lot. Constituents are always like, hey, this is important to us, so like, please re up them. But like for us to come with them with aggregated data
Yeah.
is really important. So this evidence helps us demonstrate the impact of telehealth to policymakers and strengthens our advocacy.
Hmm.
We also do a lot of press releases, stakeholder sign-on letters. The last stakeholder sign-on letter we did had over 400 organizations in support of telehealth to the Hill, which is great. And then also we have a lot of grassroots advocacy tools that we use to amplify our members' voices. So we're just trying to pull all the strings we can to make sure that telehealth doesn't get lost in this conversation, right? Because there's a lot going on in the US
Yeah.
government when it comes to like the ACA subsidies, Medicaid cuts. You don't want them to lose sight of telehealth as well because it does play a big role in our healthcare system. It's fully integrated at this.
Yeah, absolutely. And is there anything that when you're having those conversations, is this something that can get solved without the government, without the shutdown finishing? So if this is a continuing resolution, is this something that can be reinstated without shutdown ending?
Yes, it's a great question. So because telehealth currently is tied to government funding, right? Like the deadlines ended at the same time as government funding. The
Hmm.
most reliable or most immediate vehicle is going to be a continuing resolution. That's why we are so hopeful that telehealth is going to move in that vehicle. There are standalone measures on Capitol Hill right now that would make telehealth permanent, the Connect for Health Act. And then there's another, the Telehealth Modernization Act that would extend these flexibilities for 2 years that Congress could act on. But it's very hard, and I'm sure you know this, for Congress to really pass a standalone bill at this moment in time. The bipartisanship is just not there for passing items like telehealth, and telehealth is very bipartisan. But just because of everything that's gone on this year with reconciliation and all those different types of very partisan things, I don't think there's any appetite to push something through just on a standalone basis. So it's going to have to either take place in a continuing resolution or an end of year package, which it's like a Christmas tree. Everyone sticks everything they can in that big, like 1,000-page document and tries to get it through the across the finish line. So our biggest ask is, hey, from now on, just don't include it or don't put it on the same timeline as funding, right? Separate it because look what's happened. Now we're in the situation where millions of patients have lost access to critical
Right,
care.
right. Okay. Many have called this moment a telehealth cliff. Can you kind of walk us through the key policy or reimbursement flexibilities that are at risk and what needs to happen legislatively to prevent lasting damage?
Yeah, so the term telehealth cliff really captures what's happening right now. But because without congressional action, we're at real risk of rolling back years of progress in virtual care access. So let's walk through what's actually at stake. So at the center are the Medicare teleflexibilities, as I've been mentioning multiple times. But what does that actually entail, right? So during the pandemic, Congress and CMS temporarily waived a number of restrictions to make telehealth accessible to more people. And those waivers have essentially defined how patients experience virtual care today. First, there's the geographic and originating site waivers. So before COVID, Medicare would only cover telehealth for patients who lived in a designated rural area, like I noted, and who traveled to a specific clinical site. So they had to be within the four walls of a provider's office, like a hospital or health clinic, to connect with their doctor remotely. This flexibility has allowed patients to receive televisits from their own home during the pandemic, right? Because we waived these geographic and originating site requirements. So this was really the most transformative flexibility, I would say. Um, and something that's really the most important for us. And then second, the flexibilities have expanded audio only coverage, which I mentioned. This has allowed patients to have visits within their or with their providers over the phone, which is really critical for older adults, like I said, because sometimes maybe they're not familiar with this like Zoom
Yeah.
platform.
Yeah.
It can be confusing to open up the laptop, log in, sometimes you're on mute and you're like, why am I
Right.
on mute? All
Yeah.
the questions. So
Yeah.
audio is very, very important in
Also,
some
like
circles.
ultimately, if you just need a test result, that doesn't need to be a video call. That can just be a phone call.
Exactly, and it's more efficient for the provider too, quite frankly, They can just get on with their day once they're done with that audio only call and go to their next patient. So it's really helps the overall healthcare system be more efficient. Third, physical therapists, occupational therapists, speech language pathologists, and audiologists have been able to deliver telehealth services during the pandemic.
Okay.
Before the pandemic, they were not able to do that. So today, really, they're at risk of losing coverage overall. Like right now, they're technically not able to deliver telehealth services.
Right.
Will it continue? Some are, just because, like I said, they're hoping to reinstate the flexibilities. But this is huge, especially for patients who are recovering.
Yeah.
And there's been so many studies done that recovering within your home is so much better for the patient. They have their family around them, they're more comfortable. So we don't want to lose access to that. And finally, rural health clinics and federally qualified health centers, which serve some of the most vulnerable patients in the United States, they're able to provide telehealth services as well and be reimbursed for them. Before the pandemic, they were not able to, which is surprising. So we want to make sure that we're keeping all those flexibilities top of mind. And then, I think we, over the past 5 years, maybe took them for granted, right? Because it was so easy, because it was just kind of like, we just all hopped on the train. But now that they're gone, we realized how important they actually were.
Yeah. And also in terms of the renewal, like we were like, "Oh yeah, okay, cool, just keep it rolling, keep it rolling." And now we've realized this is a huge, I mean, I think we all already knew that was a huge problem, but now it's kind of come back and really jumped out.
Exactly. Yeah. And the short term extensions are just not great. The every, 6 months to 3 months is
Right.
not helpful
It's not a
for us.
sustainable way to.
No.
I have a you mentioned, you didn't mention behavioral health at all. Where does that fit in terms of these approvals?
Yeah. So that's a great question. I kind of left it out because it's a unique situation or a unique caveat. So telemental health and telebehavioral health became a permanent part of the Medicare program back in
Okay.
2021. So they no longer are subject to the geographic and originating site requirements. So basically, patients that need telebehavioral health can receive that anywhere across the country, and it's fine. And Medicare will reimburse for that. But when they made those permanent, they implemented an in person requirement. So now that the flexibilities have lapsed, this in person requirement has come into place, meaning that new patients that seek telemental health
Mhm.
have to see their provider in person before they can have telemental health visits. So
Okay.
that's very unfortunate, right? Because that defeats the whole purpose of telehealth. And like I said, we know all the barriers that come with going in person. And especially for
Yeah.
telemental health, we've seen
Yeah.
the data. It is there, it is
Yeah.
strong. I mean,
Yeah.
most Americans are receiving some sort of mental health treatment, and it's over telehealth, to be quite frank. They want to be in their own homes when they're doing that. They don't want, especially if you're in a small town, they don't want to be seen at a doctor's office or a psychologist's office going in. They don't want people to see that. They want it to be private. So this has been really a critical time for behavioral mental health. But now that this in person requirement has come back into place, that opens up a lot of questions of, you know, does this apply to new patients and established patients or just new patients? Like there's so much, because we've never had a lapse in these flexibilities, there's a lot of uncertainty right now, a lot of confusion. And CMS, quite frankly, hasn't put out the appropriate guidance for people to understand how these should be used moving forward. So that's the caveat with behavioral health. It's a great thing that people can take advantage of it, but yet this in-person requirement is kind of inhibiting care.
Absolutely. And are you kind of hearing situations where obviously there are providers, both, whether it's behavioral health or physiotherapy, a whole bunch of different fields where people might be licensed across states. How do I now travel to my physical therapist who is, 300 miles away from me? Uh,
So we don't hear too much from the patient perspective just because that's not our membership base, but we know those concerns are definitely there. I mean, even in like news articles, we see the patients, their concerns with traveling across state lines. We know how important licensure, interstate licensure is and breaking down barriers to care through licensure. That's one of our top priorities at the ATA. I obviously don't focus on the state aspect of things. Licensure right now is basically governed by the states, not at the federal level. And since COVID or 2020, right, they've really expanded the ability for providers to practice across state lines. Many states have implemented licensure compacts. Many states have implemented different exceptions to licensure. So, like Florida, they've got a lot of, you know, people that come in the wintertime, elderly people that just want to stay there to be warm. They're able to continue their care with their doctor, maybe back at home
Hmm.
in California, whatever it may be. So there's a lot of exceptions out there. Obviously, more can be done. We always say that, and we continue to advocate for that. But I mean, that's a big concern too for providers. They want to make sure that, first of all, they're complying with all the state laws, but number two, they have the ability to continue providing care to the patients they've seen for years.
Right. Right. That's it. Especially when it comes to behavioral health or something, you want that continuity. You want
Right.
that peace of mind. Let's kind of take a step up again to kind of look at the system, because this kind of crisis is revealing these kind of vulnerabilities within the system. What does this shutdown tell us about the resilience of our telehealth infrastructure and our policy frameworks? We kind of touched on this with the constant renewals required, but I'd love to kind of get your insights there.
Yeah, so that's such an important question because moments like this, like you said, really do expose both the strengths and weaknesses in our healthcare infrastructure. And what we're seeing right now says a lot about how far telehealth has come. So the fact that so many of our members are continuing to provide virtual care even in the middle of a shutdown, and despite the reimbursement uncertainty, is truly remarkable to me. It shows just how deeply integrated telehealth is woven into the fabric of modern healthcare. Providers aren't offering these services because it's easy or because it's profitable right now. They're doing it because it's what their patients need. So that willingness to take financial and operational risk speaks volumes about how indispensable telehealth has really become. So it also highlights how much patients value it, right? People have come to depend on convenience, the safety, the continuity that virtual care provides, right? Especially older adults, rural residents, and those with limited mobility, like we discussed. And when the flexibilities lapse or federal operations stall, it's not just a policy problem, right? It's a disruption of people's lives and their
Hmm.
health.
Yeah.
So it's very unfortunate. And at the same time, this moment really exposes the fragility of policy framework that underpins telehealth, right? So we build a system that patients and providers rely on, but it's still tethered to temporary authorities that can disappear overnight, which is scary. That's not sustainable, like we talked about. If we want a resilient healthcare system, we need stable, permanent telehealth policy that isn't at risk every time there's a funding lapse or a shutdown. So, in many ways, this crisis proves both sides of the story. Telehealth has proven itself essential, but the policy scaffolding around it hasn't caught up yet.
And looking forward, what kind of message do you want to send to healthcare leaders, to policymakers about the role of telehealth in safeguarding access? Like, what should they know when it comes to emergencies and every day and beyond, in terms of the ATA and where we look to in the future?
Yeah, so looking forward, I think the key message, and this may sound very simple, is that telehealth is essential and it's here to stay. So we need to come up with a policy framework that is permanent, that providers and hospital systems can continue to build this infrastructure, continue to make our healthcare system better, more efficient, more safe, more cost effective for patients across the country through telehealth. And I don't think I discussed this, but telehealth isn't just a video visit, right? It includes so many other things. It includes remote monitoring. It
Hmm.
includes digital therapeutics, which is something new that we're now taking on. It includes, AI. It really has expanded so much just in the past 5 years from just the video visit. And I'm excited about it. I think providers are excited about it. We need to also make sure that we have the right infrastructure in place to allow the policy to excel. So what I mean by that is if we make telehealth permanent, that's great, right? So maybe every patient has access to video visit now, which would be awesome. But like I said, if the broadband isn't there, if the affordability isn't there, then we're still not getting any better because people really struggle. It costs a lot of money to, have access to the highest broadband, like we were talking about, or to get a computer, or to get a cell phone. And a lot of people don't have that privilege to just go get one of those on a random day, right? To have a telehealth visit. So we need to make sure that the infrastructure is there for the policy to excel. That's another lesson or another um, thing I would advocate for on Capitol Hill or across the country to different state and local governments as well.
Yeah, I think that's really important. It's not just about the policies being there. It's not just about the access opportunities. It's about making those access opportunities equitable so that everyone can really leverage them. Alexis, thank you so much for your time today and for this deep dive into the policy situation and the government shutdown. I really appreciated it.
Thank you for having me today. And thank you to Title Care again for being a member of the ATA. We greatly appreciate all your support. You all are wonderful. So thank you so much, Joanna.
Thank you. For everyone listening, if you enjoyed today's conversation, please be sure to follow or subscribe wherever you get your podcasts. New episodes drop every 2 weeks, and please share this episode with a colleague who is passionate about digital health access or rethinking care delivery. Access Amplified is brought to you by Tyto Care. I'm Joanna Braunold. Thank you so much for listening, and we will see you next time.